Did you know that heart disease is the top cause of death throughout the world? Every year, millions of individuals are affected, but owing to modern treatment, there is hope. Introducing coronary stents, the small lifesavers that potentially change the game for individuals suffering from heart disease. In this video, you will learn about coronary stents and their importance in the treatment of heart disease. Although there is a little chance of complications, such as re-narrowing of the artery or blood clots, regular checkups with your doctor can help monitor your condition and verify that the stent is operating effectively. By the end of this video, you will have a thorough grasp of coronary stents and their role in treating heart disease as lifesavers capable of restoring blood flow to the heart and lowering the risk of a heart attack. One prevalent misperception concerning coronary stents is that they are a long-term cure for heart disease. Stents, while improving blood flow to the heart, do not cure heart disease. Another common myth is that stents are always required to treat heart problems. Lifestyle modifications, such as eating a balanced diet and exercising regularly, can improve heart health and prevent the need for a stent in certain circumstances. Furthermore, some individuals feel that stents are always the greatest option for treating cardiac problems, although this is not always the case. For other patients, other treatments, such as medicines or bypass surgery, may be more suited. It is critical to review all of your treatment options with your doctor in order to develop the optimal strategy for your specific requirements. Coronary stents are thin wire mesh tubes used to keep a constricted or obstructed coronary artery open. They are used in an angioplasty procedure, which is a minimally invasive treatment intended to unblock blocked or restricted arteries and restore normal blood flow to the heart. Coronary stents are inserted in the artery to assist maintain it open and prevent it from narrowing again. This can enhance blood flow to the heart and lower the chance of having a heart attack. Coronary stents work by keeping a narrowed or obstructed coronary artery open, allowing more blood to circulate to the heart. Angioplasty involves inserting a catheter with a balloon on the end into the blocked or constricted artery. The balloon is then inflated to open the blocked or narrowed portion, and a coronary stent is inserted to keep the artery open. After that, the balloon is deflated and removed, leaving the stent in situ. There are various advantages to employing coronary stents, including enhanced blood flow to the heart and a lower risk of heart attack. Improved blood flow to the heart can help relieve symptoms including chest pain, shortness of breath, and exhaustion, as well as lower the risk of recurrent heart attacks. Furthermore, coronary stents are a minimally invasive surgery, which means they are less dangerous and less intrusive than standard surgical methods. Coronary stents can improve the health and quality of life of heart disease patients by restoring normal blood flow to the heart. They provide a safe and effective method of treating blocked or restricted coronary arteries, as well as helping to lower the risk of future heart problems. Overall, coronary stents are an important tool in the treatment of heart disease and the improvement of heart health. You loved the video, please like and subscribe. It will assist YouTube in reaching more people and raising awareness. Let us now return to the video. While coronary stents provide many advantages, there are also dangers and difficulties connected with their usage. Re-narrowing of the artery, also known as restenosis, is one of the most common problems. Restenosis happens when the artery narrows or becomes obstructed again after the stent is placed. This can happen because the stent can produce scar tissue or plaque buildup in the artery, which can cause re-narrowing. Another potential complication of coronary stents is the formation of blood clots. Blood clots can grow within the stent and produce a blockage, resulting in a heart attack. In some situations, blood clots can break free and move to other parts of the body, such as the brain or lungs, where they can be fatal. To reduce the risk of these and other potential consequences, it is critical to carefully follow your doctor's instructions and to attend all scheduled follow-up appointments. To help lower the risk of future heart problems, it is also crucial to take any prescribed medications as indicated and to make lifestyle changes such as stopping smoking, eating a balanced diet, and getting regular exercise. Heart disease is a major and pervasive public health problem that affects millions of individuals around the world. Fortunately, modern science has supplied a remedy in the form of coronary stents, which are little but powerful implants that can have a significant influence on the lives of people suffering from heart disease. Coronary stents can relieve symptoms and lower the risk of future heart problems by keeping a restricted or blocked coronary artery open and boosting blood flow to the heart. It is critical to underline the life-saving potential of coronary stents for individuals with heart disease. If you or a loved one has heart disease, it's critical to understand the treatment choices available, including coronary stents, and to work closely with your doctor to establish the best course of action. Heart disease patients should expect greater health and a higher quality of life if they receive effective therapy. Let me tell you about a person's experience with a coronary stent operation. Meet Bobby Johnson, a 65-year-old Colorado resident who has always been active. In his spare time, he likes to go trekking and fishing, but he's been feeling tired and having chest pain when doing so. As a result, he goes to see his doctor, who expresses worry and refers him to a cardiologist at Denver Memorial Hospital. Bob is taken to Denver Memorial Hospital for a series of testing, including a stress test and a coronary angiography, which finds a blockage in one of his coronary arteries. The cardiologist informs Bob that the blockage puts him at danger of having a heart attack and suggests a coronary stent operation. Bob is concerned, but he recognizes the need of taking measures to maintain his heart health. A team of skilled cardiologists at Denver Memorial Hospital performs the coronary stent operation. A small metal mesh tube, or stent, is put into the blocked coronary artery during the surgery to help increase blood flow to the heart. Bob's surgery goes well, and he is able to go home after a few days. Despite considerable soreness and weariness in the days following the procedure, Bob follows his doctor's recovery recommendations and begins to feel better each day. He begins to incorporate lifestyle modifications into his routine, such as frequent exercise and a healthier diet. Years later, Bob is back to his active lifestyle, hiking and fishing in Colorado's gorgeous mountains. He is glad for the prompt decision to undertake the coronary stent treatment and the second opportunity at a healthy heart it provided him. He now tells his tale to others and promotes early intervention and heart health. Bob's coronary stent experience emphasizes the importance of heart health and early intervention. He is now living his life to the fullest, thanks to the medical staff and his determination to adopting healthy lifestyle adjustments. Allow Bob's experience to motivate us to pay attention to our body and prioritize our heart health. A healthy heart signifies a life full of excitement and joy. Thank you for taking the time to watch. Remember to show your appreciation by clicking the like and subscribe buttons. See you in the following video.